Welcome to The Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to The Consult Before the Cut. I'm Brittany DeSherry. Of course, I've got with me Dr. Jonathan Weiler and Taylor Besh. And we are going to dive into a little topic today about filler migration.
Big topic. I feel like it's getting bigger and bigger.
So,
yes.
Taylor, obviously, if you could just kind of filler migration, what is that? What is happening when that takes place?
You know, I feel like this is, I guess I would say, trending term or becoming more prevalent in the industry because there has been an explosion of, number one, injectors.
Yes.
And people using hyaluronic acid filler throughout, the world. And we are now seeing, I don't know if I'd call it a complication, a side effect of the amount of filler that's being injected into a face. So we're going to dive deeper and we'll bring on one of our injectors in a bit. But what is filler migration? What is that term?
Quickly explain what filler is. So some of our listeners may be a little naive, but quickly explain, Taylor, what filler is, what the category is.
The best thing invented.
It is the best thing invented. So it really is.
Filler is hyaluronic acid, or the ones that we're going to talk about today is made of hyaluronic acid. So the companies, Galderma, Allergan, they formulate, so they use something called hyaluronic acid, which is actually a natural occurring polysaccharide in our body.
Naturally occurring.
That the companies formulate into a sterile gel. So it is a volumizer that is injected into the face.
Right. Because as we age, right?
Right, to replace the volume loss.
Right, our face is like a balloon with a skull in it. That's right. And everything shrinks, including the skull. And so our balloon is not as tight as it used to be. It sags a little bit. So we revolumize, right? It is a youthful thing.
It is it can be very beautiful. It can be overdone. And so that's where the negative rap comes on with HA filler. But the volume or the filler can migrate if done, and that's what we're going to focus on today.
Correct.
Not even improperly. Sometimes it can just happen, and there's ways to navigate that. So we're going to kind of dive a little bit deeper on what that means.
And I want to say one statement. So filler is good, filler is great, but like anything else, automobiles are wonderful, right? But if you get enough of it out there and you do enough filler, probably there's been over 1 billion people injected with filler, right? There will be occasionally issues, either be it from, the filler itself, the person's body, or the way it was injected, right?
Did you say an automobile is...
No, think about automobiles.
I'm like, explain.
No, so my point to that is if you do enough of anything or you drive enough, you're going to have an accident.
It's a numbers game.
It's a numbers game. That's what I mean. I'm sorry. That was a very male way to put it.
I don't know where we're going with this.
It's if you, so it's like I'm a surgeon, so eventually there will be a problem with surgery.
Yes,
there will be an infection or something will happen. And it doesn't mean the surgery was bad or the surgeon's bad. It doesn't mean what you did was bad. It just it's a numbers game.
Yes.
Exactly what you said.
Well, the good thing about filler is it can be corrected. We can correct this issue, correct?
Yes, I'm going to go off of him. I remember 12 years ago, I had my first filler complication. It wasn't even a big deal, and I thought it was the end of the world. I'm never doing it again. He's like, Taylor, man
Tell her to quit. She had a resignation in her hand.
I will never do this
again. This is the medical field. There will be some bumps in the road, Taylor. There will be some bumps in the road.
That's it. I'm done. I would like to put in my resignation. Right, it's been fun.
So the beauty of hyaluronic acid, you can dissolve it.
Yes.
There are 2 products that we use or that is, available to dissolve hyaluronic acid. That is called hyaluronidase.
Hyaluronidase.
It is used, for filler emergencies, but we're talking today for filler migration.
Not an emergency, something that just moved to where it's not supposed to be.
Right.
Yes. So the main areas for filler migration. So filler migration is basically your body pulls the filler in an area that it is not supposed to be. So we will focus, and Jim Brown will talk a little bit more about this, but primarily you see filler migration on the lower lids and above the lip.
Okay.
It can move in other areas, but that's the two primary areas that we will focus and that you will see in clinic.
Is that the more noticeable? Is that because that's probably a little bit more noticeable?
There's two actually circular muscles in those areas. And so over time, it kind of walls off the filler. It can be placed too superficial in the lower lid. The upper lip, that is, I would say, the number one area that you will see and hear about it. And there is there are numerous reasons. The filler is too big, the placement,
the muscle,
just
thinness of the skin,
the structure, natural structure
of the body
lip.
there.
Which goes back, I know we had kind of talked about before, like if you don't have a lip, it's really hard to put something in it. Like there's like the certain things that you have to do, like the lip flips and stuff to kind of help it out.
You have to have surface area to place the product. And that's the lip flip is where we talked about that.
Yeah.
And slow and steady, no matter what, where, how you do filler, that is going to be the best option to prevent filler migration and to prevent other complications. So that's kind of what we stick to. The two products that we use, hyaluronidase and Vitrace. We use hyaluronidase. It is, more human DNA recombinant that is accepted by our bodies. And so we've done studies where you can put a syringe of filler on a little glass slide and then squirt the hyaluronidase on top, the Hylenex on top, and it completely dissolves the filler. So I'm going to keep wanting to kind of wait for Jim Brown, but the beauty of it is that it fixes the problem. But the downside of it is that it may be dissolving a little bit of your own hyaluronic acid in that area that you have produced. So we don't want to overdo it. So it's not something just to play around with.
Right.
But if it's done delicately in the right plane, the proper placement, then it can be.
Let me ask you this, Taylor. So filler's been around for, in your estimation, how many years? A long time. I mean, since you've been
probably
in practice. So
25 years.
Yeah, probably close to that. And so filler migration is a problem.
In the United States.
Filler migration is a problem that has slowly increased in prevalence, right?
Why do you think that is? I feel like in the last, it obviously was around for a long time, but in the last 7 to 10 years, I think it has skyrocketed. Or maybe we didn't know what it was before.
I think it's the amount of filler, not per patient, but the amount of people that get filler is tremendous. Filler when it first came out was, for 60-year-olds and 50-year-olds. And now it's moved into 20-year-olds in terms of lip augmentations or improvements. So we do a lot more filler these days. The patient population is a lot more accepting of filler. There's a lot more filler out there. And then also the secondary thing is I think the quantities of filler being injected probably has gone up in terms of per patient. Some people use filler improperly. Filler is, and there's a lot more, I don't want to use the word maybe poorly trained injectors out there. And so, unfortunately in the medical world, anybody with a medical license could just about do anything they want, right?
Yeah.
And so that's a real problem. It's a big problem in surgery. We do have, non-core providers getting into plastic surgery, but it's a huge problem in the aesthetics industry where you have people that do have a medical degree and all of a sudden they wake up one day and say, I want to be an injector. They watch a video and then they start injecting. And so, filler can be, you want to have a very highly trained injector in correlation with a core provider, typically a poor MD provider, working together in conjunction. And so I think it's a combination of just the sheer volume of people getting filler. The popularity has exploded really over the last 5 or 10 years. And then the sort of skill of some of the injectors is not where it needs to be, in my opinion.
Do you think, does it just happen overnight or is it just a slow?
So I would say majority of the time the patient has no idea. They come in for their next syringe of filler and you have to have that hard conversation with them that the best option today would be to dissolve here rather than add more product there because it's going to worsen your. But, I was doing research there. The American Academy of Facial Aesthetics said 80% of the time the patient wants to wait it out, let it dissolve. They just decide not to dissolve. And that is their option. But it's also, our responsibility to say, okay, then you probably should wait on doing more filler in that area because it can worsen. Okay. So some people are okay with it, and it's like, not hurting you. It is just the aesthetic,
the appearance,
of what it looks like.
Right.
You're saying some people don't even know that it's migrated, and so it's just kind of when you go in to do that assessment, it's like, oh.
I would say majority of the time, and I will say this has been around much longer than filler. I can tell any person on the street that has had tear trough filler 10 years ago. You can see if it has kind of coalesced into that spot. You can see that translucent area, and they had tear trough filler. I will ask patients all the time. They'll come in for a lower bleph, and I'm like, "Have you ever had tear trough filler?" No, I mean I did once 5 or 10 years ago, and you're like, "That's it. You don't need a lower bleph. You need to dissolve what you have. That old filler that is not going away."
And tear trough filler, guys, is filler that's placed right below the eyelid, right on the top of that bony area right there. Very common. It's a great procedure if done properly. And I think we've learned a lot in the last 10 to 15 years about placement of fillers, right? And that's really what you're talking about.
Well, like you were saying earlier, it being a numbers game, is it always associated with just like too much volume in that area? Or like you said, is it just person to person? Some bodies may just shift, like you said, muscle and all that kind of stuff. Is it typically related to the injector technique, or is it sometimes just patient specific?
I would say that would be a multifactorial answer because I think it's product selection. I think it's the plane it was injected, the lip it was injected into, the person that it was injected. If they have a very strong orbicularis oris muscle, that muscle around the mouth. If they do not have support of the lower lid from the, the mid cheek area, if they don't have that support, that's a very, very big question or answer.
Yeah. There's like a lot of factors that go into it.
Everything matters.
That's a great intro.
Let's
we're going to welcome our expert, Jen Brown, but we're going to take a quick cut. And before we go, we'd like to thank our sponsors as always, right? Rejuvime Medical, the age-defying clinic. It is Louisiana's premier anti-aging. We specialize in hormone replacement for men and women, GLP-1s, aesthetics, and peptides, right?
Yeah.
And then the Weiler Plastic Surgery Group, which is the largest aesthetic plastic surgery group in the state of Louisiana. We've got 5 surgeons. We've got way over now 10 injectors, multiple locations, and we'd like to thank them for their support. So we're going to cut for a second here, come back with our expert injector. Taylor is also an expert injector, but we're going to double up on the injectors, right?
Yes. Well, you can never have too many, obviously. But we're learning.
There you go. See you guys back in a sec.
I'm Ashley Shelley. I'm from Baton Rouge, and I've had Sculptra, Botox, and aesthetic procedures at Weiler. I realized that it was time to start taking care of my skin. There were certain concerns that I had, loss of volume in my face and the texture. I knew that I needed to do something about it. Sculptra has boosted my self-esteem and increased my confidence in my skin. I'm 40 years old, and my skin has never looked better than it does now. My name is Parker, and I'm on semaglutide with Rejuvime Medical. My entire life I was an athlete. Stopped doing sports by the time I got to college. The college life just takes a hold of you, and all of a sudden I was not where I used to be. So I started on a really small dose, and within a week I lost 3 pounds. 3 months I was down 30. Kept on doing it because I wanted to see how far I could go, and then I was down 71 within probably 9 months. Choosing Rejuvime was by far the best decision I think I've ever made.
Hey, everyone, welcome back. We have our expert injector with us, Jen Brown. Welcome. Thank you for joining us today.
Thank y'all for having me.
All right, Jen, tell us a little bit about yourself. How long have you been injecting, nurse practitioner realm? How long have you been?
So I've been a nurse practitioner for about 5 years and injecting for about 3.5 years.
Okay. Mm-hmm. Okay, so before we kind of get into this filler migration thing, what's your favorite place to inject filler?
That's really hard because I love to inject it all over. I like to balance your entire face. But I would have to say probably the most injected area would be the lips. It's the easiest area to inject to actually provide rejuvenation to the face.
It's the gateway drug to filler.
Oh, absolutely.
What do you feel like your happiest patients are? Are they lip patients? Are they cheek fillers? Are they But, you know, what
Probably a combination of the mid face as well as the lips. Yeah.
Okay.
Mid face is my favorite, I will say. I think it makes
I think you feel like the most rewarding area is full face rejuvenation.
Absolutely.
Yes.
You think somebody with a limited budget, they want to correct one area. The easiest to achieve is the lip.
Absolutely.
Do you agree?
I agree.
Yeah.
Yes.
Okay. But yeah, full face rejuvenation in an older patient that looks like
it's amazing.
the best.
It is.
Amazing.
The best. So I want to know what brought you into this world.
So, funny story. As a regular RN, I was able to work with breast cancer patients. So, I got to see firsthand flap surgery. And I fell in love with it. I fell in love with the strength of those women coming in. I loved and enjoyed being able to talk them up. Like, girl, I mean, I know you had cancer and I'm so glad you beat it, but your body is banging. Like, let's do this. Like, we are in here picking out swimsuits
really
and everything.
You
So,
really
and
are.
I enjoyed it. I enjoyed the confidence that I got to like instill in the patient. So,
And it's carried on to Weiler
absolutely
plastic
loved
surgery.
it. I love what I do. Yes.
So filler migration, do you feel like it is one of the hopping topics that we deal with?
Yes. Yes. It's definitely
And sometimes
a big
I
topic.
say that, but then do you feel like some patients are completely unaware? I mean,
100%.
Yeah.
There's tons of patients that walk into our office and they're ready for their yearly syringe of lip filler. And I'm like, let's talk about your goals. Let's talk about the results you're really trying to achieve.
yeah.
When that patient comes in, okay, so you've done my lips, I come back and I'm like, all right, Jen, I'm ready. Like, give me some more. And you look at me, what are you looking for? That
Yeah, how
you're
how does a patient know? How do you know that?
You're like, ooh, we should probably do some
Correct.
dissolving here.
What's your alarm in your head that says this patient's coming in, they're obviously happy with you, they're coming back, you've developed this relationship with them. It may not have been filler that you placed. It may be filler from years ago, correct?
Right.
And how do you tell a patient, how does that conversation go?
So depending on the area, obviously lips being probably the most prevalent, you can tell. So you see more fullness. They lose the definition in that border of the lip, which is usually the result that most patients want. So they come in, they're wanting these defined lips and they're chasing these defined lips, but they can't achieve them because they have this huge amount of fullness above the lip. So I usually start the conversation off with, show me a picture of what you would like your lips to look like. And obviously them showing this has this amazing defined border. And then I educate them like, okay, so for us to get this, we have to remove this filler that has now moved into above your lip, basically.
To the wrong area, right?
Yeah.
And once we remove this, we are now starting with a blank canvas. This is our brand new canvas, and we can now choose the correct product and technique to achieve the results you want.
Okay. So I've come in, obviously, at this point, I have a little bit of fullness on my upper lip from previous filler. And I say, okay, Jen, I'm ready. Dissolve it. What is that? How do you dissolve it? I know Taylor.
what's the process, right?
Yeah, I know Taylor had talked about like it being injected a little bit, but what happens? Do I get numb? You know how she's
a wuss.
First and foremost, I'm like, what is our numbing process here? No. And how does that process go? How do you dissolve it?
So yes, you can absolutely be numb.
Thank you.
I usually put the numbing medication on just, mind over matter. And we go from there. So depending on where the area is, depending on how much needs to be injected, as Taylor mentioned earlier, you do have to be mindful of how much hyaluronidase you inject because we don't want to affect the natural HA tissue, HA area in your face. So we would go in, determine how much hyaluronidase we're going to need and inject, obviously, with my wonderful nurse standing next to you, holding your hand,
Right.
Thank you.
providing comfort to you.
I need all these things.
Is it a one-time thing?
So yes and no,
Okay.
depending on the amount of filler that needs to be dissolved. Lips can be tricky depending on if it's above the lip. Sometimes we actually have filler that migrates into that wet border, which can be a little bit tougher to dissolve.
Which the wet border is what we were talking is like on that
Back here.
inside, like on that in.
So you often hear people say you have duck lips. It can occur obviously from the filler being migrated above, but also underneath with pushing on
Pushing
that
out.
lip. So
Pushing-
again,
oh, okay.
you're never receiving the results that you truly want until you get rid of that. Outside of that, it's also very uncomfortable underneath your lip.
So it's uncomfortable underneath. So is the actual injection? Obviously, I know we're numbing, but and when you're getting the injections, is is it painful? Like, does it burn? I don't know. I just feel like if I'm dissolving something, I feel like does it burn or does it hurt?
So full transparency.
Okay.
Yes, it burns.
Okay.
The cool thing is that when you inject hyaluronidase, it for the first 2 minutes is when it's doing its most action.
Okay.
We are vigorously massaging you.
Right.
So
Ice packs, massage.
You're getting all the things.
And positivity with Jen.
Absolutely. I'm the entire time, I'm sorry, but you're going to be so pretty when we're finished. Right. But for those first 2 minutes it does burn. Okay. It's uncomfortable.
But
not
it's spicy, but it's over before you take 2 deep breaths.
That's what
it
like.
is very short-lived.
We're all here for transparency. This is where we're finding out the information. I don't want you to lie to me. No, okay, so
but
that's done.
Back to the question. You can have 1 to 2 to 3 sessions of dissolvent. Hopefully it's just one and done. Right. We do see you back in a couple weeks after and then reassess. So you may have that dissolved again, or she may say, wait, and then we can re-inject you. It just kind of depends. So she's going to reassess you at your next visit.
Absolutely.
And Jen, what do you think are the reasons? Obviously we're not presenting a scientific paper here, right? But what do you see as the reasons for causing filler migration in your practice? Which is over in Slidell, which is killing it over there too.
So obviously there's many, again, multifactorial. Right. So overfilling, choosing the wrong product, and just anatomy. And these things are important for an injector to know previously, before injecting that patient. So obviously lips, we talk about lips all the time. I have patients who will come in with extremely thin lips and they want my lips.
Right. They want a massive, beautiful, large lip,
full,
you want these big, giant lips. Right. But we have to be realistic as to what, we can achieve. And oftentimes I tell them, again, Taylor said it earlier, start slow. We need to pick that softer product. You may not get a full syringe. We may only be able to do half that time and then come back and we can reassess.
Right.
So overfilling probably would be one of them. Technique, I've heard people say if you put filler above the lip, it helps the lip to roll out more. So
false news.
Right.
And then that was the weekend class that I did. It's like, got it.
So yes, obviously false.
So product, technique, skill of the
Absolutely.
injector, misinformation.
100%.
Some of it, obviously, probably a little bit of aging, processing,
support of the tissue.
Absolutely.
And then some of it is we don't understand everything, right? So some of it is just
it is
just
what
an
it
anomaly.
is.
It just happens.
It can happen.
I
Even
agree.
in the best hands, it can happen, right? I mean, we had we did some training. And they flew in injectors from Beverly Hills.
Yes.
To a good friend of my wife's. And she had a serious issue with the filler and migration. And this is, world expert, not going to say who it is, not throwing anybody on the bus, but does many stars. And so even in the best hands, things can happen. Yeah. Things can certainly happen.
I want to kind of take away from the lips and go to the eyes, because I think that's been around even longer. So I want you to give me your definition of what Tyndall and what you see around the eyes.
So Tyndall effect. This occurs when either the filler is placed too superficially or sometimes, again, with that lack of support in the mid-face to help hold up and support the filler that you're placing underneath, the eye tends to slip into a more superficial area. So it's a bluish hue. And you've seen it. Everybody's seen it in somebody. Where you're looking and the light kind of cast, and that skin is very thin in that area. So,
and we're talking specifically right on the lower eyelid, right above the bone, right now.
Yes.
In some people's defense, some people do have translucent skin, and
it's different though.
But it is a definite.
Yes.
You're exactly right. You can.
It's
there
a
is
blue.
a difference, and it's something you can see walking down the street.
Well, that's what I was like. Taylor's like, I could spot it a mile away.
You can.
But the rewarding part is that you can fix it and then recorrect it.
Yes.
So same process that you talked about with the lips, you absolutely have that hard conversation with the patient. And they think it's allergies, or they think
that's a
they
big
have
thing.
no idea.
Well, I mean, living in the South where we are, I mean, everybody's got allergies, and I bet, it's like, oh, this is normal. It's like, no, we can fix that.
Yeah.
And the one thing I've seen, so I no longer do filler, but when I was doing it, this was in the early days, people would come in and said that their injector saw that and then put more.
Yeah, no.
So you used to see that, which was crazy. You would see the Tyndall effect, and then they'd be like, oh, that's because I didn't put enough. And these people would come in. Remember we had that lady, Taylor? I mean, she had 4 syringes of filler underneath. I mean, it looked like she had like Rocky, after she.
Oh,
Yes.
Shaq.
Oh yeah.
Yeah.
I mean,
You know
this
it's
poor
bad
lady.
when you know exactly. You're like, I know exactly what you're
exactly
talking
what
about.
it is, and that used to be the answer.
Yeah.
So same process for the lower lids. Would you treat it the same way?
Absolutely. I think you have to clear that canvas out. Start fresh. Get rid of it. A lot of people do. I have patients who come and say, "Well, if you just put more, what can you hide it?" And I'm like, we're just making it worse.
Yeah.
So
Now,
let's.
what about post procedural care? Do you guys think that affects the possibility of filler migration? What is y'all's post procedural instructions to these?
Oh, that can cause
Yes.
the migration?
Yes.
Oh, okay.
Okay.
Is that like so?
Can something cause it? Yeah.
I don't know. So you guys, what are y'all's post procedural ice packs, elevation, relax? Is it patients that maybe get too active? Could that be a cause or no? Are we stretching it here?
I think that's a little bit of a stretch. I mean, anything can happen. Obviously, if you're going and smashing your face and pushing
Vigorous
in the
massage
area.
would be the only
Yes,
thing I would say
Could cause it
could cause
Yes.
it. Vigorous massage.
because you can push filler around after
Absolutely.
it's injected.
Right.
There's no doubt.
We don't have the patient
sure.
like taking the
Right.
lip and
Yeah.
massaging it out. You don't want to do
Right.
that. You want to leave it alone.
Right.
Don't touch it.
Daintily put your little ice pack on
Right.
the area that we inject
Right.
and, keep it clean, low key, like you said. But I don't think that you're going to actually massage it all out of your lip.
Back
And
in the
we
day,
have-
No,
Don't
back
touch
in
the
the
darn
day, some
area.
of those instructions 15 years ago, we used to tell patients to massage the lips vigorously. So
I know.
when we first started.
Yeah.
So
Do you think that filler migration is a part of why, filler has the bad rap because of the look of filler migration?
Definitely. That's absolutely
Absolutely.
one reason for sure.
And what?
get me on my soapbox here.
Well, I'm just asking because that's a big thing. Like when we're talking about
Yes.
mainstream media
Right.
and everything like this, you see these people that have this filler migration and
I think
they're
that's
like,
more
oh, I look great, but
overfilled.
it's like
I would agree with Taylor. I think that
It's more
especially
overfilled?
patients when they walk in, my older ladies who I love to feel their lips because they don't realize just how much a lip can rejuvenate the bottom, like the lower half of the face. But they are terrified, and it's because they'll tell, "Oh well, I saw so and so on TV, and that looks awful." And it is. I think more so what Taylor said. It's more of just the overfilling that's causing the migration, and they don't like it, and including even in the mid face, the big gigantic cheeks that in the nasolabial folds that are now like falling.
Is that
So-
well? I was about to say, can you have obviously we talk about the lips and the eyes being the ones that you can see. Is there a lot of mid-face migration or like around the mouth?
Nasolabial folds can migrate, and also with Tyndall
What's a
effect.
nasolabial fold?
Yeah, what?
Okay, so these beautiful smile lines that we get, gravity
so
takes hold
happy.
and gravity starts to pull down. So that's another thing that can cause migration, obviously. But again, this is when you need to make sure that your injector knows how to inject that filler correctly.
Yeah.
Because placed too superficially, I've had patients come in and say, I never had these little chipmunk things going on right here. What is that? And I'm like, oh, that's filler.
that's
like,
filler.
You need to get rid of that.
Let me do
So,
that.
yeah, I mean, nasolabial folds definitely you can.
Okay, I was just curious.
Yeah.
How long after?
yes.
How long after the dissolving of the filler
Yes.
can I come back and you can put some more?
So I want you to come back 2 to 4 weeks.
Okay.
The body reacts to hyaluronidase by swelling. It's just the way that the body reacts to it. So I don't want you coming into me in a week and you're still swollen and I can't tell what I'm injecting. So
Okay.
I want everything to be a brand new canvas.
Okay.
In addition, Taylor mentioned it earlier, you want those channels that were open where that filler may have left an indent, like to close back up. So
Okay.
you want a clean base when you come back in. So 2 to 4 weeks.
You want that
You-
nice tight anatomy back before you re-inject
Get it?
with filler.
Well, you said something it's swelling. You said there's swelling. Is it like swelling like after you have filler swelling? Is it what's
I would
it?
say comparable to after filler.
Does it
swelling.
last long? I guess is what I'm like. Is there like a lot of? Is it going to last for a while? Like, is
So
it
it
hours,
is very
days of swelling?
short-lived,
Okay.
in my opinion. It is, so think of it, it's a liquid. Think of it like
Okay.
injecting saline into the area.
Okay.
So you are going to have immediate fullness in that area whenever you inject the Hylenex, but it is going to go away very fast.
And it's dissolving that
It is
product.
Yeah.
amazing watching a terrible tear trough, like a Tyndall effect. It is amazing injecting it with Hylenex, and you can visually see
it go away.
Very satisfying.
It is very
Very
amazing
satisfying,
because
absolutely.
it can be very instant. Now, it takes time for it to completely go away, but yes, you can see it pretty quick.
Are there any contraindications for patients that can somebody not receive
not receive
Hylenex for
or
whatever
not
reason?
get their filler dissolved.
Yeah.
Vitrace, the other product,
Vitrace?
Hylenex is good. Vitrace, you have to do a skin test
Okay.
to see it's actually bovine. I think it's sheep, maybe sheep.
Cheap derivative.
So you have to do a skin test before using that. But
Is that an injected?
yes, it
Okay,
is
it's
also
injected?
dissolves
Okay.
hyaluronic acid. As far as Hylenex, like an active infection in the area.
Okay.
Right.
Some of the same things that we would watch prior to injecting.
Yeah, and over injection of Hylenex is also that would be more of the hesitation. You don't want to inject with more than is necessary because now dealing with an emergency or something
You're
like
gonna do
that,
what you have to do.
then you're
Right.
going to do what you have to do and dissolve everything. But as far as like elective migration, you're going to go very slow with that.
So
go ahead.
I'm sorry. I got all the questions
No, go
today,
ahead.
girls. I'm like, so we talked about doing that follow up to make sure that we have the blank canvas. So, in 2 weeks, I come back and I'm kind of at that blank canvas area. Things are starting to, like you said, tighten back up. Are we okay to do filler at that time, or would you like to wait a little bit more? Like, or is it patient specific? Is there kind of like a certain amount of time? Like, Jill, you want to give it a month before we start putting filler back into that area for like healing purposes?
I would say it's patient specific.
Okay.
I have patients who I've dissolved their lips, and in 2 weeks they're like breaking the door down because they're ready for their lips back. So, and we can inject, and we
My husband's
have,
asking me why I look so bad.
listen,
That's what I'm like.
We
If you
have
dissolve my
successful
lips, I'd be
results.
like, Jen, I need you now,
Yeah.
please. Thank you.
most people are ready.
Okay.
Again, it depends. If there's multiple sessions of Hylenex, well then yes.
yeah,
but
obviously.
for somebody who
After that last dose.
you come in with that clean slate, we're ready to roll.
I love that. And that's why
I want to play
filler is
devil's
amazing.
advocate.
Oh, I love this.
We have one of our providers, you'll probably remember this case. She had a patient who had terrible lip migration. I mean, like that. But she had it for probably 5 years and was accustomed to looking like that.
Right.
So our provider had the hard conversation. She dissolved it. I remember 5 days later, that lady was going crazy on our provider because she despised it and she wanted it back.
She liked what she had.
You get used to
Right.
That look.
that look.
At that point, do you just throw some filler above the lip?
So,
for patient
I
satisfaction?
now have that conversation
Look.
with the patient. Listen, I am taking away this big mound
Yes.
of
Absolutely.
fluid that you may like,
Right.
or that big mound
Yes.
of product that you may.
And I was gonna ask that. So so when patients come in with saline implants and we're gonna do an exchange, 7 to 10 days before we will remove the saline out of there it's a quick 10-minute procedure.
Brittany's face is
Yes.
like, what?
I'm sorry.
So that's the reason I'm saying this is because we talk about it, we review it, we never do it immediately because it is such a mental change to walk in literally with breast implants. 10 minutes later, you walk out. They're still in there, but they're deflated. So it's very similar.
Very.
Some people, it is a psychiatric issue. That
Somebody write that down. That's going to be another episode that we need to discuss.
we're gonna have
Like,
to.
wait a second.
That's a good one. But no, how do you mentally? So look, I think the majority. Obviously, if somebody has a nodule or an obvious bleb, right? They know, hey, that's a filler issue. But true, like problematic filler injection by someone that's been way over injected by an unethical and untrained injector comes in with a giant deformity that they may like. How do you approach that?
So beauty is in the eye of the beholder.
Thank you. It is.
It is in the eye of the beholder. And so if you love that,
Right. And some people
And
do.
that is your look.
It's some people do.
yeah.
Then-
It's what makes the world go round.
then we can have that conversation. I cannot tell you or force you to
Yeah.
get Hylenex. My goal is always I want to provide you with safe and beautiful results. So
Right.
if that is your result, then
Yeah, I think it's going
Not,
back to
not,
that
look, I always say
expectation
this.
of
Not
the
everybody
patient.
has good taste.
Yeah, right. Well, I
beauty
mean-
is in the eye of the beholder.
Right.
Sometimes
it.
I'm not the beholder.
That's
So
Well, so I feel like
So have that discussion. Be careful what you do. Right?
Absolutely.
Make sure you're on the same page because it is a it is a psychiatric journey to go through, have your filler dissolved, and then have to have like that fresh canvas that you're using, and then have to repaint the canvas. So you guys are also holding some hands when you're doing this. Do you think this is
big time?
Do you
Yes.
think?
Oh,
I'm going to
yes.
ask you.
It's a journey.
I'm going to ask you guys 2
100%.
questions. Number one, do you think this problem is overblown because of social media? And number two, this is more towards you, Taylor. Do you think this problem is getting less and less with the more availability of products out there, with the full spectrum? Or is it getting worse because of access to all these injectors out there?
I would say worse because of access, but I do think that the product selection is getting better.
Absolutely.
And the knowledge, and we're talking about it today. All of that is gonna, I think I'm very hopeful and optimistic for where we're headed with this. But over the last few years, it has definitely gotten worse, in my opinion.
Okay. And
agree.
social
agree?
media? You agree? So is social media good or bad for this? Is it blowing this problem out? Or are people coming in with great filler that they want dissolved because of
No,
social media?
I never see
No.
that.
Okay,
No.
not happening.
I think patients are now more educated. I think that social media has awakened this, or revealed what good filler looks like. So now you have patients who are more aware and starting to read and starting to invest more in their injectors and starting to credential their injectors.
That's a very, the information, and really just almost like Google reviews. People come in. I've been reading about you for 2 years, Jen. 2 years I've been following your reviews. I've been wanting to come see you to do people do that, right?
Absolutely. Yes.
People do that for you. Yeah, you have these little fans that is following you and watching you and making sure that you're good. It's crazy.
Another thing, we tell a patient, lip filler lasts for 6 to 9 months. They do that several times, 6 to 9 months apart. But then I will see a patient back 2+ years after, and that filler is still in their lip. So I do feel like the breakdown of filler, I mean, they talk about MRIs 10 years after, and they can still detect HA filler in the midface. So there's something to that too. The breakdown gets slower with the.
I think
What is it? Why
I
is
think
it?
that you build that, and I say this all the time when I used to do it, you build that foundation, it does not take as much, and it starts to last longer. And I'm not quite sure why. I think everyone's body reacts a little bit differently too.
Yeah. So we say 6 to 9 months, but and patients hold on to that.
They do.
Right.
So they're like, it's gone. I'm here 9 months.
need
Got to
it.
get it done.
Right.
I need it.
Whenever it may not be necessary because you're still holding on to that product.
I think that's why before and afters are so important. I'll have patients who'll walk in and say, I'm here for my 6-month lip filler. And I'm like, all right, so what are our goals for your lips? And they're like, well, I don't know. I'm just here for my 6-month filler. It's gone.
They just hear me. They want to talk to
Literally,
you, Jen.
they
love
just
you.
here, and I'm like, well, let's go get some before and afters. Like, you
wanna hang
still
out with
have
you.
filler in your lip, but let's go. And
If
I
you
think
wanna
that's
do a little
important.
more.
Yeah.
Y'all touched a lot on product, making sure you're choosing the right product, making sure that you're really, putting the appropriate product in the appropriate place. Are there any fillers that have more of a tendency to migrate than others?
So yes, and
Give
of course,
our listeners a red flag if they're walking in
Yeah.
and they're going into a new injector. Does that make sense? What should our listeners be worried about?
If I come in and I tell you that I want, hey Jen, these are my lips, and I'm looking, like you said, I want to make sure my little border's good on my lip. I just want a plump, nice, hydrated lip, and then you tell me.
Jen,
what is a terrible
hi,
filler to
I have
put there?
heard that
Yeah, was
Voluma
it-
lasts for 2 years in the lips. Am I able to do that today?
There you
No.
go, Taylor.
again, your injector needs to know the products that they're injecting. Voluma does not go in your lips. It is made to mimic the areas where bone lies. So you need to know that, and your injector should know that. Lip filler we have tons of them. We have so many tools in our belt, but
crazy.
each tool is used to create a different
Right.
result. So yes, you walking in and you want very natural, very soft lips, then you're not going to get the thickest filler that I have for the lips. You're
Yeah.
going to get my soft and buttery filler. So I do believe that it's important to know,
Yeah, so
I would think
that's
it's even more important for the lower lid product selection.
That's what I was about to say.
There's a
What
very small
yes.
toolbox that we use for the lower lids
Only
that
got a couple.
attracts the least amount of water.
Yes.
Because a product that's going to attract a little bit more water is going to add more fullness to the lower lids. There's really only one product that I specifically like for the lower lids, but there's other that are indicated that,
Does it
you
make
would
it too
think.
heavy? Is that why it's kind
No, I was gonna go. No, y'all keep going because I was gonna. I had a. This is on topic, but so I had a patient came in yesterday who needs filler and not surgery, and so I think you guys just touched on it. I think if you said, what are the 3 questions every patient should ask their injector, or challenges? Number 1, is this the right product for where I want my results? Number 2, are these results achievable in this one session, or do we need multiple sessions, right? 1, 2, 3, 4, 5, or maybe multiple years, right? Or am I better off with surgery? And number 3, can we give a layout financially of what it was to achieve my results, right? And I think it's very important. Those are like, the 3 questions I feel like every patient should ask.
Yes.
Because you really can accomplish
Absolutely.
a whole lot and avoid a whole lot of issues with those 3 questions.
Consultation process is the most important part of your visit not even the treatment, it's the consultation process.
When you educate a patient, they then feel empowered.
Right.
And so them having the knowledge, they're going to make better decisions with you. They're going to trust you more. They're going to be on board for the process. So education.
It's
huge.
So I'm not trying to put an end on this episode, but the best way to avoid and what to do about migration is to avoid filler migration, right?
Absolutely.
And that is good injectors, good questions, right? Realistic results, and understanding that you may not be able to achieve that big. Nothing wrong with wanting a big old full giant lip, but understanding that probably not your best injector is not going to get you there in one session.
Absolutely.
No.
Anything
It's
else?
a journey.
Yeah, anything
we
else?
always talk about it.
It is a journey, Britt. You are right. Life is a journey.
Yeah, make sure you've got a really good road trip buddy, because it's a journey.
Take a friend with you.
I know, exactly.
Take a friend. Go visit with Jen, right?
That's it. Come see me.
Anything in closing to kind of leave us with a pearl of wisdom about migration or what you've seen? Because you're an excellent high-end injector. You have been in this industry for a few years, and you've certainly seen the explosion of some of these problems and issues on social media. But leave us with a little pearl.
So,
putting you on the spot.
Injection. Well, first of all, fillers are beautiful, and they can be beautiful.
They are.
I always tell people your best injections are the one that are undetectable. So obviously, find an injector who can align with what you want and can provide you with the results you want in the safest, most informative way.
Yeah, form that relationship,
yes.
right? Form that. It's like almost, I always say, and I'm not trying to insult, but it's like a hairstylist, hair coloring lady, right? You have that trust and faith in those ladies.
Absolutely.
So I do.
I always
think
tell
that's
my
important.
hairstylist the same way I tell my injectors, which my injector's kind of sitting on the other side of the room right now. I'm like, I don't do this. You do. I'm like, I don't know. You have to tell me.
Right.
When I get my hair done, I don't know what would you like to do? I don't know. I don't know my hairstyle, and that you help me. It's like making sure that you find that right person.
Jen,
is
you're the
so
best.
Great.
Thank you, guys.
Thank you so much for being here.
Everybody, make sure to make your consultation appointments
Yes.
with Jen
That's
for
right.
all your filler migration needs.
Especially if they're in the North Shore, right? Yep.
Thank y'all so much for listening today. Don't forget to give us a little follow along with our Instagram and TikTok.
Subscribe below.
Yes, I'm like, it's at the Consult Podcast for our YouTube channel, and it's also we're on all the streaming platforms now. So when you're driving in the car, give us a listen, working out, all the things, and always remember, stay curious, stay informed, and make sure you consult before you cut. We'll talk to y'all next time.
Bye, guys.
Bye.